As a health foundation, we've been invested in wellness for all communities in the state of California. And we know that so much of what influences health status and life expectancy across this nation and in our state has to do with factors outside of the health system. And so we have been focused on what's been known as the social determinants of health. What we've learned over the years, particularly over the last decade, is that the single driving, contributing force to all of those social determinants of housing and poverty and unemployment, at the core of it is structural racism in America.
If we're not naming structural racism and white supremacy as the root of inequities, of health and other life inequities, our solutions cannot be durable and lasting. The California Endowment is committed to advancing racial equity because we are committed to dismantling white dominant culture, white supremacy, and we believe that by centering Blackness and moving those who are most marginalized to the center of our solutions, will we get to more equitable outcomes and more equitable opportunities for all people.
The health consequences of structural racism are scientifically documented and affect individuals, families, and communities. Racism causes disease and shortens people's lives. Even if you are white, insured, college-educated, and upper income, racism is shortening your life.
We are in a convulsive moment in this country. We finally, maybe, for the first time in my lifetime and maybe for the first time in centuries, are addressing our racist past and really interrogating our white supremacist culture.
The field of philanthropy, like any other institution or organization in America, is not immune from the legacy and ever-presence of white supremacy. The California Endowment acknowledges that. So we are on our own journey to more fully live into our values and transform so that we, as individuals, as an organization, are in deeper service to the communities we serve all across California.
So the only way to be a healthcare foundation is to address these healthcare disparities and understand that at their root, they are about racist superstructures and a white supremacy culture.
Those that are most negatively and adversely impacted by injustice are the ones closest to the solutions and the right policies and the right practices and the right systems changes.
Our planning efforts will be more durable, more impactful if we follow our community's lead, if we co-design strategies with them. The idea of whiteness, it was established to create these hierarchies of value. Those ideologies, those institutions are as ever present now as they were then. That's why we're advancing racial justice. That's why the California Endowment is on this journey to become an anti-racist organization. It is actively working to dismantle anti-Blackness and the invisibility of Indigenous peoples.
We're not going to be distracted. We're not going to be moved off track. We are on this journey.
But we have to assert that each one of us owns a piece of the racial injustice problem in America. We are all directly impacted, and we all need to work lovingly to build solidarity across our superficial differences and create a California and a nation in which we all belong. That is our vision of a beloved and healthier California. Our partners have taught us that in order to get to that vision, we must directly and explicitly confront structural racism and create time and space for healing. That's the hard part, because you can make the policies, you can make the grants, you can have the practices and the procedures, but are each one of us at the California Endowment showing up in a way that embraces racial justice and racial equality?
It's one thing to say we're committed to it. It's one thing for the field of philanthropy to say they're committed to it. It's another thing to actually live into it and practice it. We have an active responsibility to live into anti-racist practice. We're going to fumble. We're going to make a lot of mistakes. It will be imperfect, but through that process, we get to show our vulnerability and walk that talk of becoming anti-racist and modeling it to others.